Welcome back to my stand-up channel. Boris Johnson abandoned an election promise today as he announced a £12 billion a year tax raid to address the funding crisis in health and social care. The PM confirmed a new 1.25% health and social care levy based on national insurance (NI) contributions will be coming into force next April. He has pressed ahead with the plans despite widespread backlash from senior party members. Mr. Johnson entered Downing Street in 2019 claiming he had a clear plan to fix the social care crisis, and the manifesto which helped secure his landslide election win later that year promised not to raise national insurance. The Prime Minister accepted he was breaking a Tory commitment to voters, telling MPs, "That is something I don't take lightly." But he said, "A global pandemic was in no one's manifesto. The people of this country understand that in their bones." The levy means someone earning an annual salary of £24,100 would contribute £3.46 a week, around £180 per year. A typical higher rate earner on £67,100 faces paying £715 more annually. Mr. Johnson said the tax would raise around £12 billion a year, which will mainly be used to fund the NHS backlog. It will also cover the reform of the social care system in England, ending what Downing Street described as unpredictable and catastrophic care costs faced by many families. Under current arrangements, anyone with assets over £23,350 pays for their care in full. Number 10 said 1 in 7 people now pays more than £100,000 for their care, adding that the system can lead to spiraling costs and the complete liquidation of someone's assets. The PM announced a cap on payments for social care, saying that from October 2023, no one starting care in England will be forced to spend more than £86,000 over their lifetime. From this date, anyone with assets under £20,000 will have their care costs fully covered by the government, while those with between £20,000 and £100,000 will be expected to contribute to their costs but will receive some state support. The Prime Minister said the cost of the COVID meant it would be irresponsible to fund these reforms by borrowing. He said, "We must now help the NHS to recover to be able to provide this much-needed care to our constituents and the people we love. We must provide the funding to do so now. We not only have to pay for the operations and treatments that people decided not to have during the pandemic. We need to pay good wages for the 50,000 nurses who have enabled that treatment and who can help us tackle waiting lists that could otherwise expand to 13 million over the next few years." Scotland, Wales and Northern Ireland will receive an additional £2.2 billion in additional health and social care spending from the levy. In addition, there will also be a 1.25% point increase in the dividend tax to ensure those who receive their income from shares also contribute. Initially, national insurance contributions will increase by 1.25% from April 2022 as systems are updated. From 2023, the health and social care levy element will then be separated out and the exact amount employees pay will be visible on their pay slips. It will be paid by all working adults, including those over the state pension age, unlike other national insurance contributions. The Prime Minister's official spokesman said that only a broad-based tax like national insurance or income tax could raise the kind of sums needed to deal with the problem. He argued that national insurance represented a fairer solution as employers, who also benefited from a healthy workforce, would contribute. "This is a progressive and fair way to raise money," the spokesman said. However, critics say the plan won't reform the social care system and will hit young people and the lowest paid the hardest. Labour leader Sir Keir Starmer said the government should be asking for more from wealthier people by getting them to pay from their stocks, shares, dividends and properties. He said what Mr. Johnson had announced was a tax rise on young people, supermarket workers and nurses. A tax rise that means a landlord renting out dozens of properties won't pay a penny more, but the tenants working in full-time jobs would. A tax rise that places another burden on business just as they are trying to get back on their feet. He told the Prime Minister a tax on wealth aimed at those with the broadest shoulders should be used to pay for an improved social care system. Read my lips. The Tories can never again claim to be the party of low tax, he added. Care leaders are also said to be furious that most of the money will go to the NHS. Over the first 3 years of the new levy, some £5.3 billion will be spent on social care, with the rest set to help the NHS tackle its backlog. ITV's Paul Brand said the main reaction from the sector is that the funding falls way short of what is needed to address the staffing crisis that has primarily been blamed on low pay. In the run-up to the announcement, Tory MPs have been critical of the plan to raise national insurance, while economists highlighted the historically high tax burden. But despite the outcry ahead of the announcement, criticism from Conservative backbenchers in the Commons was muted. Source: metro.co.uk. Please like, share and subscribe. Thank you for watching.